One of the big questions in all this is how was Dominguez Garcia able to get into UNM Hospital with a gun? And what can be done to keep guns out? Kim Vyas reports hospital officials are looking for answers.
The security and police presence after yesterday's incident at UNM Hospital was massive. But what about before? Hospital officials say they do have 45 security personnel on staff, but they are not armed. When an incident like yesterday's occurs, officials say they immediately notify UNM police, as they did yesterday.
This is when you find out what works and what doesn't.
UNM Health Sciences spokesperson Billy Sparks says hospital officials are already looking at what, if anything, needs to change. This is not the first person to get into UNM Hospital with a gun. One thing that could stop that are metal detectors. UNM Hospital officials say that is something they'll look at.
As far as we know, there's no other hospital in the country that has medical detectors in every entrance. There are medical detectors in ERs, and that'll be one of the things that we'll be discussing.
But Sparks says there are many issues to consider.
Somebody who's distressed coming into the facility, do they all of a sudden say, well, you know, you can't sit down here yet because you've got to stand in this line and wait to get through the metal detector.
And Sparks says they must also consider the massive number of people they deal with. UNM Hospital has 6 entrances and each year treats some 600,000 to 700,000 patients and sees about 1.5 million visitors. But the top priority is making sure every one of them is safe.
Everything's on the table. When you go into an incident management assessment and debriefing, you have to go at it that way.
Kim Vyas, KRQE News 13.
Well, as we saw earlier, the hospital does have a surveillance system and it is monitored 24/7. Officials say there are other security measures which they do not make public.